Once measured, the arch wire is cut to the proper length and then inserted into the self-ligating MTM brackets. The wire is slipped in, and thumb pressure is used to close the clip and secure the wire.
One of the most difficult things for any lingual orthodontist to do is to tie in the arch wire that attaches to the braces that actually moves the teeth. It takes a very long time. Most lingual orthodontists will spend an hour to an hour and 10 minutes to do one or maybe even two arch changes. Well, with the advent of self-ligation, it's pretty simple. You put in a very, very light wire and you close the little bracket and you send the patient home. It doesn't take more than 10 minutes.
With the cheek retractors and drying triangles reinserted, the uppers are now polished, then rinsed thoroughly prior to conditioning. The etchant is applied to the upper anterior teeth in a similar manner to the way it was applied to the lowers. Again, it is extremely important to take extra care in rinsing away all of the etching material completely. The teeth are dried thoroughly, and primer is applied to seal the teeth. With the teeth fully prepared, the first bracket is placed on the upper left central incisor. As before, each bracket is positioned in sequence, just below the incisal edge. Once the brackets have been positioned, they are cured using the curing light. Again, 5 to 10 seconds on each of two sides of every bracket is recommended. Before measuring and inserting the upper arch wire, it is necessary to determine the effect of contact occurring between the lower teeth and the upper brackets. If, as in this case, the back teeth are prevented from coming together, an occlusal bond will be used to build up the upper back teeth. Beginning on the left side, the uppers are cleaned once again, rinsed, and conditioned with Neobond etching gel. As before, Dr. Roncone emphasizes the importance of thoroughly rinsing off the etchant to avoid the risk of decalcification. In this instance, he recommends rinsing for a full 30 seconds. And again, thorough drying is also important. A small dryer is recommended for proper drying. Then the teeth are sealed with primer, and a composite buildup material is applied. Blue Neoband paste is used to provide a visual aid for fully removing the material after treatment is completed. Once a sufficient buildup of bonding material is achieved, the application is light cured. The process is repeated on the other side, and the bite is inspected to make certain that there is no contact between the lower teeth and the brackets. If there is, additional bonding material will need to be added. Prior to wire placement, excess bonding material is cleaned away from the upper brackets. The final stage is inserting the upper arch wire. As with the lowers, the required length of wire is measured and trimmed before placement. The wire is inserted in the end bracket on one side, and the clip is closed before moving on to the other side. Once both ends are clipped in place, a stop is placed on the wire, mesial to the bicuspid. As mentioned earlier, this is used to unravel the anterior region in cases that present severe crowding. The arch wire is then pushed into the adjacent bracket and the clip closed with finger pressure. The same is then done on the opposing tooth, and a stop is added on that side. The arch wire is now inserted into each of the other brackets. Notice how easily the self-ligating clips engage the wire. With the wire in place, the ends can be trimmed if necessary, and inset bends created. All that remains is final inspection. The full process averages only about 30 minutes of chair time for the patient. In addition to the speed and ease offered by self-ligation, Placement of the brackets far from the gingival tissues reduces the instance of irritation and swelling, and the low profile of the MTM bracket offers little or no interference with normal speech.
So the MTM solves the speech problem. It solves the problem in terms of gingival hyperplasia. It solves the problem of getting the wires in to begin moving the teeth. If you've had any experience with lingual in the past, you know that in order to get each bracket on from molar to molar, you need to do it indirectly. It is a very precise, technique-sensitive kind of appliance. MTM is not like that. You never get to a rectangular wire. So these can be placed directly, depending on state law and how you practice. The brackets can be placed by a staff member and then adjusted by the doctor, or the doctor can place them. It truly only takes about a minute a bracket to adjust them and tack them. It is a very easy procedure. It's almost like it's too good to be true. And we've done enough cases now that I believe that this is something that anybody can do. Anybody who's done lingual before, who doesn't want to do it because the learning curve is so steep. This is like a slam dunk. There's almost nothing you can do wrong.
Well, the procedure went really well. It was really fast, comfortable. It was just way different than it was years ago when I had them. And I love not being able to see them when I give a big smile. It's nice, you can't even tell I have them on.
My parents like the braces because it's correcting my teeth, and at the same time, they know that I'm not having like confidence issues with people like looking at the braces all the time and things like that.
The day I got my braces on, it only took about a half hour to do. There was no pain involved because they're real small and tiny, and I haven't found any discomfort at all. They've been really easy to get used to.
It's really simple. It's very easy. It does not mess up a practice. You don't have to have these people come in at special times like lingual appliances in the past, full lingual appliances. It's a great adjunct. It's great financially. It's a great practice builder. It's easy to do, and just about any orthodontist can do it and feel really, really comfortable that he's doing a good job. It's basically, as I said before, it's almost a fail-safe. It's a slam dunk. You can't really get into trouble, and that's the best thing, knowing that you don't have to take lots of courses, that you don't have to fail 20 times before you are able to do something correctly.